Welcome to the American Red Cross Bloodborne Pathogens Training. The purpose of the American Red Cross Bloodborne Pathogens Training course is to teach you how to protect yourselves and others from exposure to bloodborne pathogens while on the job and what to do if an exposure should occur. You are taking this course because your employer has determined that you may come in contact with blood or other potentially infectious materials while performing your job duties. Other potentially infectious materials are human body materials other than blood that could carry bloodborne pathogens. Some examples of other potentially infectious materials defined by OSHA are human body fluids like cerebrospinal fluid, synovial fluid, saliva and dental procedures, or any body fluid that is visibly contaminated with blood.
Welcome to the American Red Cross Bloodborne Pathogens Training course. Here, you'll learn how to prevent disease transmission through blood and other potentially infectious material. Let's begin with some background information. Bloodborne pathogens are disease-causing microorganisms that are present in human blood and other potentially infectious materials. Bloodborne pathogens can spread when blood from an infected person enters the bloodstream of a person who is not infected. In the workplace, primary concerns are hepatitis B virus, hepatitis C virus, and HIV, because infection from any of these viruses can have serious, long-term effects on a person's health. Despite the health effects, there is no way to tell whether a person is carrying a bloodborne virus just by looking at him or her. In fact, an estimated 4.4 million Americans are living with chronic viral hepatitis, and most do not even know they are infected. Because of this, it is crucial to take appropriate preventative measures when handling blood or other potentially infectious materials. People from many occupations may be at increased risk for exposure to bloodborne pathogens while at work. Fortunately, the Occupational Safety and Health Administration, OSHA, requires employers to take appropriate measures to protect at-risk employees from on-the-job exposure to bloodborne pathogens, including training courses such as this one. However, the responsibility for lowering the risk for on-the-job exposure to bloodborne pathogens is not solely the responsibility of the employer. Employees must also take responsibility for their own health and safety. This course will give you the knowledge and skills you need to protect yourself and others from contracting a bloodborne disease on the job.
Understanding how infections spread can really help to protect you and others while performing your job duties. Watch a quick video on the chain of infection.
We share the planet with millions of microorganisms, many of which cause us no harm, and some of which actually benefit us. However, some microorganisms, called pathogens, are capable of causing disease. Our bodies are equipped with many natural defenses against infection-causing pathogens. Healthy, intact skin and mucous membranes help to prevent pathogens from entering the body. Areas of broken skin, like a cut or rash, could allow germs to enter. When this happens, we depend on our white blood cells, which patrol the body and destroy pathogens that may enter. In addition to our natural defenses, antibiotics and vaccinations are also available to help us fight and prevent infections. However, while these defenses are helpful, infectious diseases are still common. You can better protect yourself by understanding how infections are spread. For infection to occur, 6 requirements must be met. This is called the chain of infection. The first requirement is a pathogen. For an infection to occur, a microorganism capable of causing disease must be present. A pathogen will require a reservoir, or a place where pathogens can grow and multiply. Possible reservoirs for pathogens include human bodies, animals, insects, bodies of water, and food. Once the pathogens have multiplied sufficiently, they must have a way of leaving the reservoir. This is called a portal of exit, and varies depending on the pathogen and the reservoir. When the reservoir is a human body, for example, the portal of exit may be the respiratory tract, the digestive tract, the reproductive and urinary tract, or breaks in the skin. To get to another person, a pathogen will require a method of transmission, which can be direct or indirect. Direct transmission means the pathogen is passed from one person to another through physical contact. Indirect transmission means that pathogens are spread by way of a contaminated surface or object. To complete the transmission, the pathogen must find a portal of entry. Just as the pathogen must have a way of leaving the reservoir, it must also have a way of gaining entry to a new reservoir. In the case of person-to-person transmission, potential portals of entry include the respiratory tract, the digestive tract, the reproductive and urinary tract, the eyes, and breaks in the skin. Finally, the pathogen must enter a susceptible host, or a person who is capable of becoming infected with that particular pathogen. Eliminating just one link in the chain can prevent an infection from spreading.
This course focuses on bloodborne pathogens, which are infectious agents in human blood that can cause disease in humans. The reservoir for the bloodborne pathogens that we are going to be talking about today is the human body. Now, although these pathogens can cause serious disease, they are not easily transmitted and they are not spread by casual contact. An infected person's blood must enter another person's bloodstream for infection to occur. Sorry, I'm a little late with these slides. On the job, this could happen through direct or indirect contact, as mentioned in the video, with an infected person's blood or other potentially infectious material. If the blood or other potentially infectious material comes in contact with your eyes, the mucous membranes that line your mouth and nose, or an area of broken skin on your body. Direct contact simply means a bloodborne pathogen is passed from one person to another through close physical contact between two people. In comparison to indirect contact, where a bloodborne pathogen is passed from one person to another via a surface or object contaminated with an infected person's blood or other potentially infectious material. So it could be like a workstation, a table, perhaps a doorknob, things like that. Other risks that you should be aware of include a needle stick injury or an open wound that has been caused by broken glass or another object that has been soiled with blood or other potentially infectious material. For a person who is injured and bleeding, if you were to come into contact with the person's blood, Some potential portals of entry for a bloodborne pathogen would include a break in the skin or the eyes, mouth, or nose. Some other ways that you could become infected with a bloodborne pathogen while performing your job duties, as I just mentioned, include a needle stick injury or through contact with an object contaminated with blood or other potentially infectious material. It is very important to remember that anyone's blood or other potentially infectious material might carry bloodborne pathogens. Someone you know very well or someone who shows no obvious signs and symptoms could be infected. Some bloodborne pathogens pose particular risk because they can have long-term effects on a person's health. These include hepatitis B virus, hepatitis C virus, and human immunodeficiency virus. Hepatitis is the inflammation of the liver, an organ that performs many vital functions for the body. There are many different types and causes of hepatitis. Hepatitis B and hepatitis C are both caused by an infection with bloodborne viruses. Chronic infection with the viruses that cause hepatitis B and C can lead to liver failure, liver cancer, and other serious conditions. HIV is a virus that invades and destroys the cells that help us to fight off infections. A person who is infected with HIV may look and feel healthy for many years. However, during this time, the virus is breaking down the person's immune system. People who are infected with HIV may eventually develop acquired immunodeficiency syndrome, also known as AIDS, and a person with AIDS is unable to fight off infections that a healthy person would typically be able to resist or control. Unfortunately, most people who contract AIDS, they do end up dying from one of these infections. Although medications have been developed to help slow the progression of HIV infection, currently there is no cure. While looking at the next few slides, just want you to take a look at the person or the people shown on the slide and decide for yourself if this person could pass a bloodborne illness on to you. Remember, while you're looking at these pictures, it is impossible to tell whether a person is infected with a bloodborne pathogen just by looking at the person. Anyone, regardless of age, gender, race, sexual orientation, or any other characteristic that you can think of, could be infected with a bloodborne pathogen. So please just remember to protect yourself at all costs. Both employers and employees must take responsibility for minimizing the risk of exposure to bloodborne pathogens in the workplace.
Employers and employees share the responsibility for minimizing exposure to bloodborne pathogens. To protect workers, employers are required to adhere to the OSHA bloodborne pathogen standard. OSHA requires employers to maintain a written exposure control plan. This plan outlines the protective actions that will be taken to eliminate or minimize occupational exposure to blood or other potentially infectious materials. It also describes procedures that will be taken if an on-the-job exposure occurs. Engineering and work practice controls are identified in the Exposure Control Plan. Engineering controls are tools that employees can use to protect themselves and others from exposure. These include personal protective equipment, biohazard waste bags, and biohazard sharps containers. Work practice controls are procedures employees should follow to protect themselves and others from exposure. These include the use of PPE, disposal of contaminated materials, safe handling of sharps, and proper cleaning of equipment. In addition to establishing an exposure control plan, employers must provide proper training about risks associated with bloodborne pathogens and how to minimize these risks to all employees who may be exposed to bloodborne pathogens. Employers must also offer a hepatitis B vaccination to employees who are at risk of exposure. An employee may refuse the vaccination, but if later decides to accept the vaccination, the employer must provide it. As an employee, you should know and follow your employer's exposure control plan. Make sure to use the tools your employer provides and follow the procedures your employer has established to help keep you safe. It is especially important that you use standard precautions and treat all blood and other potentially infectious materials as if they are known to contain bloodborne pathogens.
So it's important to remember that OSHA requires employers to maintain a written exposure control plan, describing the protective actions that should be taken to eliminate or minimize employee exposure to blood or other potentially infectious materials while on the job, as well as the actions that will be taken if on-the-job exposure to blood or other potentially infectious materials occurs. The exposure control plan details engineering controls, which are tools that employees can use to protect themselves and others from exposure. This might include things like personal protective equipment, as well as work practice controls, which are procedures that employees should follow at all times to protect themselves and others from an exposure. So some examples of some engineering controls, give you a few minutes to think, a few seconds to think, and then I'll share some with you. So some examples of engineering controls that might be provided to you include personal protective equipment, which could be something as simple as a pair of non-latex gloves, perhaps protective eyewear, hand washing facilities and supplies, sharps containers, biohazard bags or containers if applicable, sharp safety devices, and any designated equipment for cleaning up spills of blood and other potentially infectious materials. Same thing, give you a few moments to think of any work practice controls that might be in place for you guys. So hopefully your employer, or if you've been other places, you might see signs in the bathrooms like employees must wash their hands before returning to work. These are examples of work practice controls. So perhaps LVCC is requiring employees to use appropriate personal protective equipment when performing certain job duties. If anything like this is in place, you want to make sure that you follow those work practice controls every time performing those duties. Again, I mentioned when your hands should be washed and procedures for safe handling of sharps. Here are some more examples of work practice controls, procedures for disposing of contaminated materials or for cleaning equipment that you might use to clean up blood or other potentially infectious material, So you might have a designated biohazard bag, which you might not use frequently, but if you guys are outside on the playground, someone might fall and be bleeding quite a bit. There should be some kind of exposure plan and work practice controls set in place for you all to clean those materials up properly and dispose of them properly. Okay, so standard precautions. I think this is good to think about not only when you're at work, but just in general, especially in these times with COVID-19. Standard precautions is pretty much an approach to infection control that involves treating all blood and other potentially infectious materials as if they are known to be infectious. Some examples of standard precautions, if you can take a few moments to think, but some good examples of standard precautions are making sure that you're using personal protective equipment, handling sharps carefully, cleaning up spills promptly and correctly, and handling and disposing of contaminated items carefully. So you saw in the video that OSHA requires employers to make the hepatitis B vaccine available for free of charge to all employees who have the potential for on-the-job exposure. Remember that breaking even one link in the chain of infection can prevent an infection from occurring. So, your choice in getting vaccinated against HBV, this breaks the link as the susceptible host. So again, you getting the vaccine is removing that link in the chain of infection as a susceptible host. Remember, your employer's exposure control plan only works if you use the tools that are available to you and follow your employer's procedures every time. All right, we're going to talk about personal protective equipment a little bit more. So personal protective equipment is a barrier device used to prevent pathogens in blood and other potential infectious materials from contaminating your skin, mucous membranes, or clothing. This equipment includes latex-free disposable gloves, gowns, protective eyewear, masks, resuscitation devices such as CPR breathing barriers, and shoe covers. Appropriate PPE should be used whenever exposure to blood or other potentially infectious materials is likely. Know and follow your employer's guidelines for what PPE to wear and when. And if you're not sure, ask someone. Gloves should be worn whenever there is a possibility of contacting blood or other potentially infectious materials. You should also change your gloves frequently especially if you are needing to gather multiple items to provide first aid. I would recommend maybe gathering all the items that you need first and then working on the child or whomever. That way you're not risking cross-contamination. So I don't want to start providing care, get my latex gloves soiled, and then get another Band-Aid out of a full box, because then I've contaminated the other full box of Band-Aids for the next employer or the next individual to use that box of Band-Aids. Gowns should be used to protect your clothing and body from splashes and sprays of blood and other potentially infectious materials. I'm going to move through some of these quickly because I'm not sure how much they apply to you, but it is just good to know. Protective eyewear such as goggles or a face shield Should be used to keep body fluids from splashing into your eyes when giving care, cleaning items, or disposing of contaminated fluids. Sorry, I have to go back to gowns. No, I'm not. I'm sorry. Masks. This probably looks very familiar to everyone. A mask is used to protect the mucous membranes of the nose and mouth from splashes and sprays of blood or other potentially infectious materials. Shoe covers should be worn when it's necessary to walk through a contaminated area. And CPR, breathing barriers, and other resuscitation devices are used to prevent contact with another person's nose and mouth while giving rescue breaths. So just take a moment to think about how personal protective equipment breaks the chain of infection. That's right. It does it by blocking a portal of entry for pathogens. So again, if you might have a cut on your finger or something, if you're providing first aid, you do have a open portal of entry for potentially, for blood or other potentially infectious material to enter your bloodstream. So again, just making certain that you're using that personal protective equipment every time you're giving care. Use those standard precautions. Better to be safe than sorry. You should wear latex-free disposable gloves when you may come in contact with another person's blood or other potentially infectious materials. As I mentioned just a moment ago, when there's a break in the skin on your own hands, and when you must handle items or surfaces soiled with blood or other potentially infectious materials. I would always say, when in doubt, just wear the gloves. Wear the gloves all the time. If that's all you do, wear those gloves. So latex-free disposable gloves are a very commonly used article of PPE. Nitrile gloves are preferred over other latex-free disposable gloves, such as those made of vinyl. Wear latex-free disposable gloves. I mentioned all of those 3 times. And when it's very important, I mentioned this before, when you're wearing gloves, limit how much you touch other surfaces with your gloved hands. So pathogens can transfer from the gloves to other items or surfaces that you touch. Again, as I mentioned, putting the next person who handles the item or touches that surface at risk for infection. When you're finished providing care, it's very important that you remove your gloves using proper technique and dispose of the gloves according to your employer's policy, and to wash your hands immediately. Gloves must be removed using a proper technique to avoid contaminating your own skin. I'm going to show you a video demonstrating how to remove a pair of gloves. If you have a pair of gloves at home, or you have access to a pair of gloves at a later time, I would recommend practicing this. Here's the video.
Follow these steps to remove soiled gloves. First, pinch the palm side of one glove near the wrist and pull the glove off so it is inside out. Holding the glove in the palm of your gloved hand, slip 2 fingers under the wrist of the glove. Pull the glove off inside out so that the first glove you removed is inside it. Dispose of your soiled gloves properly and wash your hands.
Okay, we're going to move on to hand washing. Hand washing is the single most effective way to prevent the spread of infection. Would like you to think about, how does hand washing break the chain of infection? Hand washing breaks the chain of infection by removing a method of transmission. You should know and follow the guidelines set in place by your employer regarding when you should wash your hands. However, at minimum, you should wash your hands before providing care, if possible, and always after providing care, even if you wore gloves. Wash your hands after touching blood, other potentially infectious materials, or broken skin. And wash your hands after touching objects or surfaces that could be contaminated with blood or other potentially infectious materials. You should always wash your hands after removing personal protective equipment, before and after eating or drinking, and of course, after using the restroom. To be effective, hand washing must be done using proper technique. For those of you who have forgotten to wash your hands properly, and it does require more than singing happy birthday, here's a quick video to show you how to do that properly.
To appropriately wash your hands, first wet your hands and wrists under the running water. Keep your hands and wrists below the level of your elbow. Apply soap from the dispenser. Then, rub your hands together to work up a lather. Wash vigorously for at least 20 seconds. Pay particular attention to the following areas. Grasp, circle, and wash each wrist with the opposite hand. Wash the palms and backs of your hands. Wash the areas between your fingers. Rub your nails against the palms of your hands to clean underneath them. Rinse your hands and wrists under the running water, keeping your hands lower than your elbows and your fingertips down. Using a clean, dry paper towel, dry your hands starting at the fingertips, moving back toward the elbow. Drying your hands thoroughly keeps them from becoming chapped. Discard the paper towel in a facility-approved waste container. Use another clean, dry paper towel to turn off the faucet, and discard the paper towel in a facility-approved waste container. Use a clean paper towel to cover the handle before opening the door. If the door does not have a handle, push the door open with your hip and shoulder to exit. As an alternative to washing with soap and water, you may use an alcohol-based hand sanitizer. After using an alcohol-based hand sanitizer, wash your hands with soap and water as soon as possible.
Just a quick review. How long should it take you to wash your hands properly? It should take you at least 20 seconds. And the areas that you should pay extra close attention to clean while washing your hands include the palms and back of the hands, in between the fingers, the wrists, and underneath your fingernails. Again, alcohol-based hand sanitizer is an okay substitute. It can certainly be used to decontaminate the hands if soap and water is not readily available. However, you should, because alcohol-based hand sanitizers, they're not as effective if the hands are visibly soiled. You should use soap and water as soon as it becomes available. To use an alcohol-based hand sanitizer, again, dispense the recommended amount of product into your palm. Rub your hands to cover all surfaces of both hands, including underneath the nails and between the fingers, and continue rubbing the hands until the product dries. Once again, if all you have is an alcohol-based hand sanitizer, that's perfectly fine. However, as soon as soap and running water becomes available, you should use this method of hand washing immediately. Disposable equipment and supplies need to be discarded in a manner that limits others' exposures to the contaminated items. Similarly, reusable equipment and surfaces that have been contaminated by blood or other potentially infectious materials need to be properly cleaned and disinfected before the equipment is put back into service or the area is reopened. Again, remember to always wear latex-free disposable gloves and any other personal protective equipment that might be necessary when cleaning equipment or surfaces or disposing of contaminated equipment or supplies. Again, if you're not sure, just throw on those gloves as a standard precaution. You should place any soiled items in a labeled biohazard container or bag for disposal, cleaning, or laundering according to the procedures specified in your employer's exposure control plan. You should follow your employer's procedure for handling sharps, such as needles or broken glass, safely. Generally speaking, dispose of sharps in an approved puncture-resistant sharps container immediately after using them. Be careful and watch as you place the sharp into the container. You should never attempt to recap a sharp object before disposing of it, because you could stick or cut yourself while trying to replace the cap. You should never overfill a sharps container. Sharps containers should be replaced when they are 2/3 full or according to your employer's policy. Lastly, regarding sharps containers, you should never open or empty or reuse a sharp container. You should never attempt to clean up broken glass using your hands. You should use a pair of tongs, a broom and dustpan, or 2 pieces of cardboard to pick up and dispose of the broken glass. Again, someone may have cut themselves on that broken glass and they may not be aware of it, or they may have just left it there. So that could be a potentially infected surface, and you want to make sure you take the standard precautions to protect yourself. Also, you should keep in mind that trash bags may contain sharp objects, so you should avoid packing them down with your hands or swinging them near your legs when you walk, or throwing them over your shoulder to take to a dumpster or trash can or something like that. Spills of blood or other potentially infectious materials must be cleaned up promptly and properly to limit the potential for exposure to bloodborne pathogens. Cleaning up spills of blood or other potentially infectious materials is a 2-part process because the surface must be cleaned before it can be disinfected. Here is a short video showing you how to clean up spills of blood and other potentially infectious materials.
A spill of blood or other potentially infectious materials must be cleaned up promptly and properly. To protect yourself and others, follow these steps. First, block access to the area to prevent others from potential exposure. Next, gather your cleaning supplies. Use the supplies specified in your employer's exposure control plan. This might include disposable tongs, disposable absorbent towels, a solidifier, disposable scoop and scraper, a biohazard bag, a biohazard sharps container, and 10% bleach water disinfectant solution. Then, put on the appropriate personal protective equipment according to your employer's exposure plan. You should always wear disposable non-latex gloves when coming into contact with blood or other potentially infectious materials. You might also need a gown, shoe covers, eyewear, a mask, or a face shield. Before cleaning up the spill, remove any sharp objects using tongs or a disposable scoop and scraper. Never use your hands. Remember to dispose of the sharp object in a biohazard sharps container. Wipe up the spill using disposable absorbent towels. Dispose of the towels in a biohazard bag. If available, you can also use a solidifier to absorb a spill. Just pour the powder onto the spill and scoop up the mix. Dispose of soiled materials in a biohazard container. Put on clean gloves. When using a bleach solution, always wear gloves and eye protection and ensure good ventilation. Then, flood the area with the disinfectant solution. Also, be sure to let the bleach solution stand on the surface for at least 10 minutes. Finally, use clean absorbent materials to wipe up the disinfectant solution and dry the area. Dispose of all soiled materials, including your personal protective equipment, in a biohazard bag.
To clean equipment, boots, and leather goods, for example, you might have leather shoes or belts, you should scrub the item using a brush in hot, soapy water. Specific procedures for cleaning and disinfecting equipment and work clothes in your workplace should be outlined in the exposure control plan provided by your employer. If another person's blood or other potentially infectious material comes into contact with your eyes, mouth, or an opening or break in your skin, or if you experience a needle stick injury, then you have been involved in an exposure incident. In the event of an exposure incident, follow these steps immediately. Decontaminate, notify the appropriate people, complete the necessary documentation, and seek follow-up care immediately. First, you want to decontaminate the exposed area. You should wash any needle stick injuries, cuts, or contaminated skin thoroughly with soap and water. If blood or another potentially infectious material splashes into your mouth or nose, flush the area with water. If blood or another potentially infectious material splashes into your eyes, irrigate them with clean water, saline, or a sterile irrigant for 15 to 20 minutes. You should be sure to report the incident to the appropriate person at your place of employment and complete any necessary documentation per the exposure control plan. An incident report form is used to record the time and date of the exposure, the circumstances of the exposure, the actions taken after the exposure, and any other relevant information about the incident. Employers must maintain a sharps injury log for the recording of injuries with contaminated sharps. The log must maintain employee privacy, list the type and brand of the device involved in the incident, and include the location and description of the incident. Once again, you should seek immediate follow-up care as identified in your facility's exposure control plan. Unfortunately, we do not have the opportunity to complete those activities. However, I do want to thank you for participating in the Bloodborne Pathogens training course. This is definitely very important information, especially in this great year of 2020. But again, just use those standard precautions all the time. That's your best bet to maintain safe and healthy for you and anyone else that you work with. If you guys have any questions, please let your supervisor or Charles know, and he can certainly contact me to get any more information. Thank you, and have a great year.